just like people. You go to the doctor annually just to make sure everything's okay. The same thing with our animals. Our animals can't talk to us, so they tell us by their behavior and their appetite, how are they doing, as well as their body condition. Normally, if everything is okay, we do an annual exam on them, and that will alert us of any underlying things that we physically can't see. Dominica is our Cownose Ray that we ended up getting from Clearwater Marine Aquarium along with her mother, Taurus. She was the pup of our geriatric population, and then on a routine annual exam, we found out that she had cancer.
When Dominica first came to us, she was that very stubborn, very young individual. She refused to eat anything other than shrimp, and she was very particular about how she ate it and how all of her food was prepared. And then, of course, because she only ate the candy bars, she ended up developing an anemia because she wasn't getting enough iron from her food. So we worked really hard with the animal health and animal care teams together to get her eating a more well-balanced diet. Once we were able to do that, we actually were able to reverse the anemia that she was showing us and get her back towards being a really healthy, stubborn, juvenile Cownose Ray. About a year after we got her, in July of 2021, Dominica presented with some really abnormal blood work findings that we found on an absolutely routine annual exam. We were concerned because of her potential for anemia and making sure that that didn't relapse. When we got her blood work back, we found something we were completely not expecting. The white blood cell count of a Cownose Ray should be between 10 and 15,000 white blood cells. Dominica's came back at 108,000, so about 10 times higher than it should have been. Looking at her ultrasound, we found that her spleen was a little bit enlarged. And we definitely raised some red flags from seeing both a very high white blood cell count and an enlarged spleen. So we sent her blood samples out to some very specific labs and some world-renowned cytology evaluators and clinical pathologists, and we were able to find that she showed the markers for chronic lymphocytic leukemia, or a type of blood-borne cancer.
We have to be a little bit more hands-on with Dominica so that way we can take more regular diagnostics. As we continue with Dominica's treatment, we decided to put her on a steroid, and then we also did the routine blood draws to make sure that her medication dose was appropriate for her, and especially as she grew, the dose would change. So we would monitor her white blood cell count, see if we had to make any adjustments. With that, that meant more hands-on with her, so we got more regular blood draws and then also the ultrasounds to monitor her spleen. And then as we were able to watch her over the past 3 years, we've been able to reduce the amount of handling that we've had to do with her because she's been so stable. So that we're happy about, and we still have a special diet for her so we can monitor her intake, and if she decreases in any way, that is something that animals tell us something might be up because they can't tell us how they feel. And so we don't know if something's wrong with her, but her appetite can tell us something. But as of right now, Dominica does great. She eats fantastic. And then she handles all of our handlings really well. And we haven't had to do it as often now.
You don't know why Dominica, of all the Cownose Rays here at the Florida Aquarium, developed these signs or this disease. But we've been able to manage it with long-term medical care, and she is doing absolutely amazing. So cancer, there's actually a lot of misinformation out there that says that sharks and rays can't get cancer, which is a complete fallacy. These animals can get cancer, but it is very rare. So Dominica's cancer was actually only the second case of this type of cancer in a Cownose Ray that's ever been reported. Dominica's case is a perfect example of why annual care is so important, not only here at the Florida Aquarium, but to each individual. You know, the reason we go to the doctor every year is not because we're expecting to find something or because there's something wrong with us. It's to make sure we're still staying happy and healthy, and they're gonna find things and look for things that we may not know what's going on. We were able to catch Dominica's cancer before she even showed any significant symptoms. She wasn't lethargic, she wasn't having any problems, she wasn't losing weight, we weren't seeing any typical suffering animal signs. We caught this before it got bad. We know that we were able to jump on this as quickly as possible, and we were able to diagnose it and get her on treatments so much earlier this way than waiting for us to find signs on accident. So an annual exam is so important for us to be able to make sure our animals are healthy and catch anything before it becomes a problem. As one of the veterinarians here at the Florida Aquarium, we get incredibly invested in the care of all of the animals here at the aquarium. And I think as veterinarians, we definitely get more attached to our medical cases. Finding a case that is unique, that is not an everyday problem or concern, is even more exciting. Now, we never want any of our animals to be sick, but we are so proud of the teams here, the animal care and health teams and everyone, that we're able to manage this life-threatening disease and give Dominica many more happy and healthy years ahead of her.
People don't realize how much goes into caring for these animals, and it's nice when everything's great. You know, the animals are healthy, but there's a lot of unknowns. We don't know everything. We are still exploring and learning things. So when we're able to be a part of something like this, it means that a future animal that has this situation, we can help with. The information that we gain from caring for Dominica, that if another Cownose Ray somewhere else presents with the similar symptoms, we can tell them her story, and then that just becomes a huge database. And that's basically what the aquariums and zoos around with the AZA accreditation are doing. We're creating a database for how do we care for these animals? How do we care for future animals? And that's what makes this worth it.